Good afternoon. So yes, my name is Lise-Lotte. I'm not from a startup, I can say. I'm from one of the leading law offices in the Baltics, Sorainen, and my speciality there is, yes, healthcare and life sciences. So we have a very, I would say, challenging topic today, like how to create an ecosystem leading health tech valley to the countries, including into Estonia. And I have very good panelists here with me, Piret Hirv, as they said, from the Estonian Connected Health Cluster. Piret, would you like to say a few words about yourself?
Yeah, my name is Piret, and really honored to be here. And thank you, Lise-Lotte, for this invitation. I have done this ecosystem work for 5 years now. But before that, I worked for the Ministry of Social Affairs, and I do have a real job as well. I'm an educated nurse, so I do have kind of very diverse picture or understanding what should be done in terms to be patient-centric or human-centric. What are the kind of trends on the policy level? But 5 last years I've been lucky to do this really practical work and bring together this ecosystem called Connected Health Cluster. But I think that we will go into this pain points later, and also success stories, I hope.
Yes, let's hope so. And then we have straight from the Norway, Eirik. Can I pronounce it like this?
100% perfect.
Okay.
Yeah.
And I understand that you're also into the e-health world and the CEO of e-health company, yes?
Yeah, it's 2 of them actually. So it's not Container, which was the introduction, but the name is Contair. It's an e-health consultancy company, and we also have a product development company called Semantic Lab. So I'm the founder of both those and also the CEO. And before that, I worked with health, also for the Norwegian government actually, as a strategist there.
So you have the state view as well?
Yeah, and I think you need to have that in Norway, because the government is the
part
main...
of the ecosystem.
The main part of the ecosystem, very strong.
And of course, last but not least, we have Priit, who is founder and CEO of Termtest.
Yes, nice to meet you. So my background is in health policy analysis. Like 7 years ago, I did health policy research. And this works now, or not. Health policy research, and I saw that you can do the perfect health policy and give it to governments, but it's not going to be implemented. So I felt that I need to do something closer to the healthcare field. So I co-founded Termtest, which is now medical software for visually heavy specialties. We have 75 hospitals and clinics, so using the software for treating, preventing, detecting different diseases, main focus skin cancer, wounds, psoriasis. And we have also hacked the system in a way that we have public reimbursement in Estonia and in Germany, and it has been quite a big long ride in that sense. So this ecosystem topic is really relevant to us.
Thank you. So maybe just to kick off the discussion, I would start by claiming that actually with any businesses, a business ability to innovate is very largely dependable on the system which is around it. So when we talk about the health tech, of course, health tech is a very broad definition term. Health tech includes medicinal products, if we talk about big pharma companies. Health tech means medical devices. Medtech means all kinds of surgical solutions, procedures, etc. So basically, with health tech, you have to understand that the ecosystems and the systems which may affect the business's ability in each of those areas might be different if you have different health tech there. So maybe I'm starting with Priit and asking, how do you see where creation of a very good ecosystem for e-health, digital solutions, maybe software as medical devices, where does it start?
Yeah, this is the short answer, but well, most in high and very high income countries, most of the resources to healthcare come from public sources. So they're somehow directed from the public sources, from tax revenues on insurance premiums directed to healthcare. So this is where it all starts. If the regulation supports the system in some way, if the regulation supports making innovation, if there's a kind of like a sentiment of innovation and a culture to do new things, then it kind of works. Getting to a healthcare system which has this kind of creative culture is, I mean, there's a lot of path to it.
Okay, so you would say that the start should come from the state level?
Yeah, well, it's always both. I mean, let's stick with the one thing right now. So e-health in itself, in essence, isn't like one product. E-health is everything. It can be a system service, which like architecture, roads that are provided by the government. So you need roads to drive on. But then like the car makers can make like good cars, but you need roads till the end of the different houses, and then comes the question like whether the roads are built by the government or by the private sector or the technology providers. So it's the definitions of e-health are really important. It's very good that there is a term called digital therapeutics, so which are like apps which are medical devices, digital health application used by patients, prescribed by doctors. This is a new hype thing, DTX, digital therapeutics. It makes sense because you focus on one specific type of like thing, and then you can start talking about the ecosystem for it, because you have a different ecosystem for pharmaceuticals, different for telehealth platforms, different for EHRs or electronic health records. So it's everybody views the system differently. So like sticking to the definitions is one starting point, and probably we'll go later on to financials and so on.
But Piret, question for you now. Do you see it similarly? Because through cluster you actually see different health tech companies. You don't only see e-health companies. Do you also see that ecosystem should rather start from the state and rather be more specific?
Actually, what I see in my work is like innovation starts way before it reaches state level. It starts from every single one of you might have a kind of burning problem. And actually what I can see also, and it comes also from the universities, from TalTech and from Tartu University, for instance, it starts from this painful problem of a single person, quite oftenly. But I do agree with Priit here as well, because what I've heard from the state side as well, that these private companies, they are building wrong kind of solutions, which cannot happen actually, because we do innovate where there is a space for innovation. And this space should be created by the government. So it starts from the really, I can't say from a small problem, because for this person it's a huge issue, and then it starts rolling from there, but the environment has to support, and government has really important role here to play. And coming back to these different stakeholders, whom we are accommodating in our ecosystem, for instance, it's true that every single type of company, or even every single company has kind of their own motivation to belong to this ecosystem. And from my perspective, we are kind of trying to find this common ground for all the companies, because there are some issues. In a previous panel, there was discussion about data, and this topic actually touches quite many members whom we are having in our, like both governmental organizations, health insurance fund, big IT companies, pharmaceutical companies, universities. digital therapeutics companies, so they are all kind of interested in
So
this
they are
topic.
kind of still universal sometimes.
Yeah, there are universal aspects. And then what we're trying to do is to design services for very specially, very targeted services for the companies. And then we try to cover topics which are really universal for all the members. And it's a tricky balance to find, but
you have to find it.
Yeah, we have to find it because our goal is to support companies to grow,
yes,
no matter what it takes.
Eirik,
Yeah.
how is it in Norway? You already have a very good ecosystem for health tech companies, or?
Yeah, but I would like to say I very strongly agree with you. Innovation doesn't start from the government. It starts from, I think, passion. You want to change the world to the better. That's my experience as well. But then you're, of course, right as well. In Norway, as far as I understand, in Estonia as well, the government plays an extremely big part in the healthcare system. So we have to bring them into the ecosystem. In Norway, the laws and regulations are quite startup friendly, I think, but there is something about the culture which is maybe not that startup friendly. And that means the government is good and commercial companies are bad, so to speak. But what I have found is to try to show empathy for the governmental strategies, because usually there are smart strategies, right? But maybe not the solutions are the best.
Yeah.
But I have actually had success with trying to bring together different actors in this ecosystem, governmental institutions, ourselves, of course, but also other commercial players and even competitors. Yeah.
Mm-hmm. So I just want to maybe hold on to this idea, what Piret said, that actually it's not all about the state, but it's about the initial idea. So maybe if we start from the bottom up, maybe we should start with academia. Where do you find those great ideas, those scientific researches upon to build those ideas and companies and startups and finally reach the consumers? So is it our environment suitable for promoting the growing of startups from academia? Piret, what do you think?
I would like to think and answer yes, because we have quite good examples, and in Science Park Technopole, where the cluster is, where the cluster is, actually we do have different programs, and the goal of the program is to bring this science into real life and really find those brilliant ideas and educate young scientists how to actually meet the needs of the market as well, which is really important because the scientific world and the real life doesn't match one-on-one like this. So you have to have quite clever in that. And again, we are coming back to funds for that. It's really crucial to have. Priit can probably tell you many stories what he was not able to do because not having enough funds for that. But it's really important to have the strategic approach that we have the funds enough to the certain point where this innovative solution is capable to fly alone already or go to this direction at least.
Priit, you want to add something?
I mean, like it's for, of course, like initially you have to have the spark. So there's a problem. You're like really want to change something. Yeah. But quite often then it's not the typical pathway in healthcare. So you have regulations for clinical clinical validation. So if you do something really that impacts health, then it needs to be measured. We have all the experience with the COVID-19. Everybody was following news how the trial for the vaccine is going. Like everybody were vaccine experts. But the same is for digital applications also. In some way or another, they impact. And this already puts kind of like an extra price ticket on healthcare applications, which price and time ticket for healthcare applications. So we have done, one of our services is a skin cancer early detection service. And we have provided it based on research from international standards. But we still felt that we need to do like an actual clinical trial ourselves also. And it took kind of, I would say, probably like 6 years. 2 years of gathering data, then applying for grants, then doing the research, and then waiting 1 year for publishing. So 6 years to do a research. It is very cool research. We're happy about the results. It shows that we're actually saving lives. But it took enormous time because you need all the data points, and there is a price ticket. We used a grant for doing it. We couldn't raise money. I mean, 6 years we get the study. I mean, it's not a very easy thing to raise on, right? But we got it and we did it, and now we can use it for further growth and show that yes, the existing research made sense, and we corroborated with our own research. And here is another element of ecosystem. So you talked about data. So why we were able to do this study was because we were able to connect to the Estonian nationwide digital infrastructure to get the outcome data points. So you might do something with a health app. It changes something in person's behavior or health, but the outcome, whether it worked, comes like a year later, 2 years later, sometimes many times later. And then this app that you have built might not have the data point. And then if you don't connect it up to the later data points, which the Estonian healthcare ecosystem really well helps you do it, well, not really well, but kind of like helps you do it, then it's possible to measure the outcomes. So measuring the outcomes.
But it's really good that you pointed out that it took you 6 years. You basically had the data, you had the idea, you had the resources finally, and it still took you 6 years to carry out this research. So I think we came to the second point of this ecosystem. When we have the idea, we have the academia where we maybe have this scientific background for the idea, but then we come to the means. And the data is definitely one of the most important input in every research. So is it do we see it already as a solved challenge? Because as you said, in Estonia, we have loads of data already in our e-systems. Or is it still something where we need to find solutions? So Eirik, what is your view from the Norway's perspective?
I can bring two perspectives on the table. In Norway, we have a lot of oil, but we're running out of oil at some point. And then we're talking about data, health data as the new oil. There is a lot of value there. But I think there is two problems. Number one is to get access to the data. Because of legal issues, right? The government tried to be open, but there are regulations protecting the
So in Norway, it's not easy to have this data for research purposes, or
it's not very hard, but it depends a little bit. But you have to do a lot of paperwork in order to get access. But the real problem, I think, is the structure and the semantic of the data. I remember 10 years ago, I was discussing with the Nordic Council, and one of the tracks there was that we have a lot of data, let's use them. But the fact was at that point, we couldn't use them because it's free text, you know. So what we are working, what is our main focus is in Norway now is to structure those data using health terminology like some at CT, using information models.
So it's reusable more easily.
Exactly, and it's only when the data is structured in a standardized computer understandable way we can take out the value.
But okay, besides data, we know that from the EU level, the legal acts are coming so quickly, covering different data aspects that you even cannot read one and you already have another on the table. So we also have loads of other regulations. AI regulation is coming up. Then we have all the different regulations for different fields of the health tech areas. So Piret, as leading this cluster, which has to help actually very different companies, how or whether you even be able to provide this assistance that young companies, they can find the means to struggle through all those regulatory burdens. Is it even possible?
It's not impossible. Well, Priit, you are kind of more advanced in using data, but true, Lise-Lotte, young companies who are coming, they are even struggling with these GDPR kind of
basic principles.
They do not understand what it is. And we have dedicated programs for that. And we have also our mentors network who is capable to guide you through this, this complicated world of data. So companies are on a really different level in terms of if we talk about how they use data and how they are capable to add value on top of this. But what I'm just jumping back to this Priit's story, how he started this. I just have to say it out loud. It's not fair towards the startups if they have to carry on the risk on their own. Like what is Priit doing? Trying to develop his solution with his own money without having this strategic support from the government. Because later on, when he's successful, then Estonian government will actually also gain from his solution and help the outcomes of our people will improve. So in that terms, I'm strongly support the Estonian government to think about how to kind of divide this risk and not to force the companies only to carry this risk.
Maybe I'll elaborate a little bit here, because when we talk about government and when we talk about data, it's like there's so big topics that it's really hard to focus on. But when we talk about government, quite often we talk about the public insurances and public reimbursement, meaning that if there's a healthcare service that is delivered by a digital health product, then it's somehow reimbursed if it provides value. So for example, skin cancer early detection, it's like the value is that you get it detected. It said that okay, it's fine, or the service says that you need to cut it out. Okay, it was melanoma. We possibly reduced millions of euros for future taxpayer cost, because melanoma is so expensive to treat and so on. So and the reimbursement is important because the saving comes in the future. It doesn't come right now. But there is change a little bit with so for example, a health insurance fund had this sample innovation fund where we were the lucky one of the 4 companies that we were able together with the health insurance fund develop those new reimbursement models which are outcome based. So for example, for psoriasis use case, we, together with Tartu University, Tartu University Clinic, family doctors, health insurance fund, we developed a new type of reimbursement. So with a patient that is followed, monitored at home with our application about their disease severity. Psoriasis is a very, very complex and really, really complex disease, but it needs to be monitored at home. So if it's monitored well and the patient's life quality increases, then the insurance fund pays more to all the counterparts in the system. to the application builders, to doctors, because they did a good job, because the person's life quality measured improved. So, and this is now like a sample project. And hopefully this kind of model will expand.
Well, basically, you're talking about this, that so far the fee for service has been like the primary reimbursement measure by the state, which means that we pay for each service which the patient receives, but we should move towards the fee for value. But just trying to maybe structure this ecosystem which we are talking about here, because ultimately the aim of this discussion is to create this ecosystem, as you understand. Well, we have academia. You agree, yes?
Yeah.
We have academia. We have already like certain hubs within the academia, clusters which support growing the startups. I understand that we also have certain means already. We have data, and as you said, you have support programs there, so even startups, they can go to, for example, free legal advice and maybe like go through those obstacles more easily.
Yeah. Even before that, you actually establish your startup. It makes sense to come
to consult and
to validate your idea already.
I understand that we have like already created within the system those like maybe basic measures to go forward. But now we arrive to this third one, and this is the financing. Because as you said, like until we are still stuck with this fee for service and we don't reach this fee for value, we're still in the middle of this conflict of those different worlds. So what I'm maybe asking from you is how to overcome now the financial struggle, the financial challenge. And I want you to give me a very practical idea. If you would be, I don't know, the prime minister or the head of the health insurance fund, what would be the next step to create the better ecosystem? Eirik.
I can try from a Norwegian perspective. I really appreciate, and I believe also it's right for the government to play an active part in the beginning of early days of a startup. And in Norway we have good founding. We have something called Innovation Norway. I think you have something similar in Estonia. Enterprise.
Yeah, Enterprise Estonia.
And we have this Norwegian Research Council, which can provide you with funding. And I think that's number one, very good for us as startup, but I think it's very important for the society as well, because in the early days there is a lot of risks. You know, you don't know if this is going to succeed or not. So I think it's very good for the government to help you there. But at a later stage, and I think that's where we fail in Norway, is to get startups access to the governmental market, so to speak. We visit a hospital. Could you give me the name of the city?
Viljandi.
Thank you. And we were extremely impressed that private companies, startups were talking to the management at the hospital. And I was told last evening that may be more the exception than the rule here in Estonia. But in Norway, that's a problem, to have access to
bring the partners together.
Yes, of course, if you have the perfect solution, the perfect system, you can sell it, right? But to have more collaboration for piloting, for testing, validation, together with the hospitals, that would be really, really good, I think.
Okay.
Yeah.
Priit, I know that you have many of ideas, but please pick one.
Fee for service is basically paying, so the public insurers paying for a very specific thing. A patient coming for 20 minutes into a doctor's office, the hospital gets money, or a patient goes to surgery and the hospital gets money, and then the patient leaves the hospital, then it's done, forgot. And this, what this kind of model incentivizes is it doesn't incentivize innovation. So it might even incentivize lack of qualities, because like, although technically it really, this is not how it's done, but financial incentives wise, hospitals are rewarded for treating a person badly, because the patient then comes back. Maybe the first surgery went bad, the patient come back with an even more complex surgery need, and the hospital budget earns. So so this needs to be changed. This has been talked like 15 years in the community that this needs to be changed.
But how do you change it?
With the value-based care, with bundled payments, with models that like pull the previous example, with a lot of models in care pathways which value or like reimburse outcomes, reimburse like person getting better. And this means rather overhaul of the whole system.
But wouldn't it result like a very like large work for the health insurance fund, because you have to value like every patient case?
Yes, it's probably not easy, and it's very like still struggling. But so, for example, 1 billion is the specialized care budget. 1 billion specialized care budget of Estonian Health Insurance Fund. And it's mostly fee-for-service. There are some other models also. But what if 10% of this money was targeted for outcomes? It would be 100 million of like a care, like a market for digital health companies and digital health services which increase patient outcomes. So it's a huge market potential, and definitely it's not easy. Definitely it's a lot of data integration and so on.
Let's agree it's doable.
Well, it's might be doable.
Okay. Piret, your idea?
Yeah. What else I can say? Of course, I would pick this opportunity to promote even stronger ecosystems. And I think that ecosystems are good partners not only for the companies but also for the government, actually, because both the actors actually can outsource some tasks to the ecosystem kind of organizations like Tehnopol. What we are doing, we are supporting companies to grow, but what we are also doing is we are giving input to the Estonian government, for instance, how to build better future for Estonian citizens, like how should this data governance should look like, what are the architectural questions we need to solve, these payment questions, how to validate, how to test these solutions. So having the strategic approach towards ecosystems and organizations who are running those ecosystems, of course we can't kind of dominate, but seamlessly we need to bring these stakeholders together, and we create value for both sides, for the private and public.
But now I have this maybe challenging question for you, but we talked about the financing which comes from the state, but private financing, investors, how to attract investors to our gold countries, basically.
I mean, like this initial financing, what I see on the market, like the first idea, the enthusiasm, like you can get the pre-seed funding pretty easily. When you get to seed or Series A, then investors, of course, want to see like steady MRR track, and well, that makes sense. But here the problem comes. So if you need to do 5 years of clinical trials, or you need to go to the doors of insurances and try to find a reimbursement model to get this MRR, then it's like 5 years. So I think the biggest kind of like death the valley is somewhere between this seed Series A areas, and especially for startups which need clinical validation, which are not like very simple service provision via like telemedicine or so on, which has some more clinical component. For them, I think it's pretty difficult, and this is the harder phase. But I think there are more and more specially focused on health tech funds coming out. People are looking into this. The funds need to have some definitely some other strategy than the current ones, than the ordinary startup funds. They need to have a little bit different way of thinking, I think.
Healthcare focused.
Or but of course the funding is possible, and we see that there are many countries which have very strong and thriving medical device ecosystem. Maybe Germany. I mean, there are lots of deep health tech funds who can invest a lot. I mean, Moderna, the vaccine maker, they got private investments like 2 billion before they started making money with the start of COVID. So it's like 2 billion of just risk, and then it happened. So it's an extreme example, but for digital health, it's kind of the same.
Mm-hmm. But Eirik, in Norway, do you have like funds who are very focused on the health tech?
Yeah, we have.
And they work well in Norway.
We have financial investors, and they are there for the money, right? And we have industrial investors who want to invest for more strategic collaboration for the future. Does it work well? No, I don't think so.
Okay, but you see some kind of a solution to that, or how could they improve, or what should be done differently?
The boring answer is I don't know.
Well,
sorry.
Yeah, it might as well be like that.
but maybe I can bring
Piret?
a bit wider picture. The Death Valley, what Priit was talking about, it's really true. It's there. But in our Science Park Technopark, and we actually start a bit sooner. Even funding this very early stage ideas, it's really important not to let them kind of collapse because they don't have this money for prototyping, for instance. And in our Science Park Technopark, we have dedicated programs for that. So you can actually get money for just playing with your idea and building your prototype, which is really important because sometimes this friends, fools, and family doesn't help you here. And then, this Death Valley comes, but it sounds awful, but we are preparing our companies to be ready for this Death Valley, actually, because we support them with how to present themselves to private investors. We also have in our ecosystem, we have investors networks. But the problem that Priit brought on the table, this is still not solved 100% because the amount of money that is required there is quite big. And one option, of course, is you can play with European projects and try to find money, but I don't find this sustainable. And this is not, it can be just good luck if you get money from there.
Well, I can see that our time is up.
Oops.
But thank you. And maybe what I gathered from this discussion is that it's all about the balancing act and being successful in it. That maybe the strategy is the main thing which is missing at the moment, at least in Estonia. But all the good ideas and stakeholders are already there to...
Yeah, and always find for good partners, or look for good partners.
But I don't know, do we have any questions from the public?
Actually, no. No one's asked anyone anything. You can still insight.votomo.eu. You can ask questions. My question to you would be, what is the one single, if you think of the past year or so, has there been any sort of development that's really sort of made you hopeful about the future of this sort of tech valley kind of thing happening, perhaps?
Priit, maybe you. No hopes?
Yeah, maybe not last year, but I just wanted to say before also that things have changed quite a lot. So there is more thought process put into the aspect of seeing the pathway of having a clear innovation pathway. So a healthcare pathway is unclear. There are lots of hurdles which we discussed. You need to see further, and one way to see further is to really map by the strategic level, have some kind of a measure of how the companies are doing who are like, I don't know, before and after and near the death valley and on the innovation pathway. So somebody should keep a track on this, because if they come through it, then it's much better situation. And I think there are quite a lot of like ecosystem from the private side, investors, government, insurers. Everybody has like pitched in a little bit, but it's improving. Let's see how fast.
Piret, do you have...
Yeah, what I would like to point out is that the communication, like about the strategic questions with Estonian governmental level stakeholders or actors, it has improved a lot during last year. So it's also giving a kind of green light for that.
And Eirik, maybe the last very good example from the last year.
I don't have, I think I have one, but we are on the right track, I can say
Okay.
so. Yeah.